Like the system of drains and aqueducts that furnished ancient Rome with water and conveyed its waste to the river Tiber, an even more ancient and elaborate system of fluid nourishment and drainage exists within our bodies as part of the lymphatics. While the nutrient circulation, waste drainage, and immune function of the body lymphatics have been understood for some time, lymphatics of the brain are a new discovery, and how by their free fluid flow they might shield against Alzheimer's disease, we stand just at the threshold of uncovering. Dr. Gerald Lemole enlightened to the import of the lymphatics in the earliest days of heart transplant surgery in America. When the first round of successful transplant patients all died within 2 years, his investigation found a failure of lymphatics to be the reason. Today he joins Vital Signs to introduce lymphatics of the brain and to highlight how we might nurture lymphatic flow for our optimum health. Welcome to Vital Signs, where we learn how to get healthy from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendan Fallon. Dr. Lemole, fantastic to have you join us on Vital Signs again.
Well, thank you, Brendan. It's a pleasure being with you again.
First of all, you call the lymphatic system the secret river of life. What do you mean by that?
Well, over the years, it hasn't been regarded as anything significant. It never, as a system, it's never been looked at like the other systems, and yet it interfaces with every organ in our body, indeed every cell of our body. The lymphatic system touches. It has more volume, fluid volume, than the blood system itself. Yet you can't see it. People don't recognize it. In medical school, it's really not acknowledged in relationship to the terrific work it does.
In a nutshell, could you explain what it does?
Well, the lymphatic system is basically the clearance system of our body. It's like the waste products we have in our garbage in our cans, and get them cleaned up every day, or when they get picked up by the people in the sanitation department. It's the same thing with the lymphatics. The lymphatics take away toxins and poisons that are in the local tissue. And something else, it's also the home of the immune system. So the immune cells and the chemicals and proteins that are moderated by the immune system are sent through the lymphatics to the areas where they're necessary. So it does so many things that are unrecognized in our society.
And I understand that it's only fairly recently that the lymphatic flow is thought to be relevant to brain health and brain function. What has brought this understanding about?
Well, we always thought that through diffusion, somehow the toxic substances in the brain disappeared, and the brain was unique. It didn't have a lymph clearance. About 12 years ago, in the laboratory, University of Rochester, Nedergaard and her team showed evidence that actually there was a clearance of the brain by way of lymph-like system, by the lymphatics that they just discovered about 2 or 3 or 4 years ago, that actually are in the space underneath the dura mater in the brain. And these lymphatics actually pick up the proteins and the particles from the extracellular fluid and carry it down to the deep cervical lymph vessels to be dumped into the blood system to be cleared by the liver.
What kind of evidence is coming through of lymphatics in operation in the brain?
Actually, and John Kepnes from Washington University have shown these particles where they inject these particles in the brain of laboratory animals, and they can follow them through the lymphatics of the brain, of the dura mater area, and they can follow them down into the deep cervical and then into the venous system. So it's pretty impressive, the connection between the lymphatics clearance of the brain into the lymphatic system of the body. And why it's called lymphatic is because it takes the glial cells of the brain to make this happen. So what happens, the glial cells actually shrink to make more space in the brain for the fluid, the CNS, the cerebrospinal fluid that comes in. So they shrink down and they create the aquaporin 4. And what it is it's basically these molecular channels that are formed in the footpads of the glial cells, so the fluid can actually run through. It's like a tunnel that the fluid runs through. So in comes cerebrospinal fluid and creates a convection current that sweeps all the toxic fluids away from one side of the brain to the other. And then it's picked up on the opposite side of the brain and carried away by the perivascular venous areas. It doesn't go directly into the vein at that point. What happens is it's carried along in a tube outside the venous vessels.
And I understand it's a specific type of glial cell, the astrocyte, through which these aquaporin tubules are formed.
If you call them glial cells, that may be confusing because they're astrocytes, branch of the glial cells.
What kind of signs are coming through that these aquaporin tubules, a problem with them or they're being malformed, would lead to cognitive decline?
Well, there's hereditary diseases that the aquaporin tubules, they don't make enough of them or they put them in the wrong place, and those people get dementia. The aquaporin 4, which is the protein that allows this restructuring, a tubular restructuring of the pod of the astrocyte, they have to be at the foot as the astrocyte encircles the arterial capillary. The aquaporin 4 tubules occur in that footpad so that the fluid can go from the CSF out into the interstitium. In this congenital disease, these are either absent. The aquaporin 4 gene is either absent or it makes the aquaporin tubules away from where they can be ejected. It's like if you have a faucet that is going into a sink. If the faucet is outside the sink and you turn it on, the water is going to go the wrong way and it's not going to produce the effect you want it to. So when the aquaporin is either absent or the tubule structure is misplaced, then these people do not get the convection flow, the flow that pushes everything through there, and they get dementia.
This sounds like a very useful sample, Dr. Lemole, of people who don't have the aquaporin tubes or don't have them formed correctly, to show what happens when that factor isn't there. But there's a general population of people who don't have this specific genetic condition, and many of which are getting Alzheimer's. How could glymphatic flow factor in to their Alzheimer's?
So you have a space between the astrocyte, which encircles the vessel, and the vessel itself. Between those two is a space where the cerebrospinal fluid flows. And in that space, what happens is when that aquaporin is effective, the CSF flushes through there and the convection current carries it to the other side where it's picked up by the same setup on a venous level, perivenous rather than periarterial. The convection current going from the arterial side to the venous side is what sweeps away all the toxins. When that current is interrupted by these bundles of amyloid beta or the tau protein or synuclein proteins, what happens is that convection current is interrupted and the toxins don't clear out of there.
You mentioned amyloid proteins and tau particles. What are they exactly?
The amyloids are actually proteins that are created to defend against inflammation. So amyloid beta is a defense mechanism of the brain against inflammation. And what happens is, as amyloid beta builds up, if it's not cleared, it becomes toxic. It bundles and blocks the clear flow and the convection of the extracellular fluid to sweep to the venous side and clear the brain of toxic substances.
It's the amyloid alpha that is involved with increasing synapses, synaptic activity in the brain. Okay.
Yeah. What the beta is anti-inflammatory. So if you don't have any inflammation, you're not going to create beta. You're going to create amyloid alpha.
So if you have generally low brain inflammation, then you won't be producing so many of the amyloid beta particles, and there won't be so much to obstruct the glymphatic flow and drain toxins from the brain. as I understand.
Right. Instead, if you have no inflammation there, your brain produces amyloid alpha, which then creates more synapses and more neuron growth factor.
Excellent. That's your ideal situation.
Yes, that's right. So it behooves us to decrease the inflammation in our body, the general inflammation and the local inflammation, so that the brain doesn't produce the amyloid beta that it needs to counteract that inflammation.
Hmm. And you also mentioned the tau particles as well. How are they implicated in Alzheimer's disease?
When they build up, they bundle together and block the flow through the extracellular interstitium. The tau proteins are actually proteins that are in the neuron to assist the microtubules. The microtubules are these very fine tubes that are in the neuron that send chemical signals back and forth from one side of the neuron to the other. And these proteins stabilize that. And they get exchanged and cleared. But if they can't get cleared from the system, they get built up and they become toxic. A large amount of them create neurofibrils and they get bundled up and they kill the nerve cells.
So they perform a helpful function, a beneficial function, but when they build up, when they can't get cleared after performing that function, then they become a problem.
Exactly.
And can potentially interfere with cognition.
Exactly. Well, they kill the nerve cell dies, the neuron dies eventually. These tau proteins can stay in the body of the nerve and actually become what they call a Lewy body that you can see in making the diagnosis. And they basically kill the nerve cell. So the synapses are destroyed and the nerve cells are destroyed.
I remember the actor Robin Williams, I think, passed away with dementia, Lewy body dementia, if I recall.
That's basically the tau protein, yeah.
And before we were talking about how if you have inflammation in the brain, you're going to be producing these alpha beta particles to fight the inflammation, but they can build up and become toxic, which can block the convection flow, the clearance of these toxic particles from the brain. That's a way that having inflammation can restrict glymphatic flow. But is the reverse of that true as well? Can restricted glymphatic flow also cause inflammation?
Well, if you have no conduits for the tau protein to leave this space between the astrocyte and the venous capillary, if there's nowhere to drain it, what's going to happen is that it's going to build up. So you'll build up your tau proteins in your brain, in the interstitium, that should cause increased inflammation, which will cause this bundles of kind of like a big figure, a big bunch of, if you've ever seen trees, branches thrown together, a big thicket, they come in and they get tangle in between the synapses and the dendritic cells.
Well, I guess this naturally leads us into what can be done to enhance lymphatic flow. And in terms of the brain, maybe it's not so well known what can achieve this at this point, but it's fairly well understood what can achieve enhanced lymphatic flow in the body to clear out toxic substances, etc. I know that sleep is a big factor in this.
Three things that they know solid about it. One is age. The older you get, the more chance you can get Alzheimer's. Second is sleep deprivation. And the third is chronic stress. So with sleep, we know that the best deep sleep you can get is the non-REM 3 level of sleep. And that's when 75 to 90% of the clearance occurs during that period of time. Very little occurs while you're awake. And they think that's because while you're awake, you're releasing norepinephrine in your brain, which then decreases the convection flow. So it's very important. There's a close correlation between poor sleep and mental problems. The idea that norepinephrine secretion during waking hours decreases the flow of the interstitial fluid. And it may well be that certain modalities like deep meditation or qigong, or I don't know, because this is a relatively new topic and the research on these peripheral things hasn't really been done. So it may well be that the norepinephrine levels change with deep meditation or qigong. I mean, those are areas that should be looked into. to see if you can increase the lymphatic flow by deep meditation and these other thoughtful experiences.
I remember reading in something that you'd written, Dr. Lemole, about how conductors often have good lymphatic flow due to the particular movement that they do. And I see some similarity there with Qigong exercise. There are some similar arm movements in those exercises, which I might explain why they also would foster good lymphatic flow.
Yeah, but the issue is there's a difference between, we definitely know that the general lymphatic system is improved with meditation, qigong, massage, etc. The question is that carried over to the glymphatic system? Because there's a two-stage situation here. The one very important stage is when you have the aquaporin tubular formations that release this fluid, interstitial fluid. And the second is the pickup of these proteins and particles by the lymphatics of the dural lymphatics and then carried down to the body. We know that exercise will change the vascularity of the lymphatics in terms of the general body, and I'm sure it probably does the same thing in the dura, but we haven't proved that it has to be done now yet.
I know that there's been research suggesting that meditation, Qigong, can actually reduce the levels of epinephrine in the body. Do you have a theory on why they would have that kind of effect?
Well, it reduces the general body's epinephrine. It's a reduction of our reaction to stress. So what you're doing is, in the overall body, with meditation, you can control your blood pressure, you can control so many things, and you can decrease your reaction to stress, which is the release of norepinephrine. We don't know if that applies to the brain. I mean, that's the situation that has to be found out, whether you can decrease the norepinephrine in the brain at the same time. If you could, then that's a real advantage and would be very helpful in clearing all these toxins.
What about on the exercise side? Is there a particular exercises that you consider?
Well, they say strenuous exercise sweat exercise is the best. Basically, the principle is that neurologic growth factors, neurotropic factors, are increased with exercise, so that the more you exercise, the better that is for your brain. So what I try to do is I have a machine that I set at 3 miles an hour. And that basically, if you go to 4, you have to trot. So basically, it's a fast walk. And I do that for a mile. And then I like to lift weights, not big weights, but 10-pound weights for biceps and triceps. There's also balance. These power plates, I think, very helpful to get your lymphatic system moving. And we have one of those. So it takes probably maybe 45 minutes in the morning, and it'd be nice if you could do it twice a day.
You mentioned a power plate. This is for balancing,
Yeah,
to balance your body.
It's more than balance, though. I mean, it kind of get your muscles react to. It's interesting. I noticed, like, if you remember when they have these vets that came home wounded or people in bad accidents, they give them horseback riding lessons, and they improve well with it. Could never figure out why would they improve with a horse. Well, if you get on a horse, you realize that the horses will move, their muscles will move, and you have no correlation with when they're going to move or where they're going to move, and your body has to involuntarily move against that. So, your leg muscles have to go against the way the horse's front leg is moving. And under those circumstances, you're retraining your muscles to be involuntarily reactive to outside forces. And I think that's how the riding helps these people that were disabled get back, because it helps them do involuntary things and relearn the nerve system and the muscle system to react involuntarily.
It's very interesting. It's a benefit to horse riding many people wouldn't imagine. You also mentioned some supplements there, Dr. Lemole. Is there a top 5 supplements that...
For the brain health, yeah, I think ginkgo biloba is always recommended. And then the two things you're trying to do is you're trying to decrease inflammation, and you're trying to increase brain cell growth. So those two things, and we talked about exercise doing that and your diet. And of course, you got to eliminate all these pro-inflammatory things like pathogens and bacteria and organic substances that are very toxic to us that are in our environment. You have to eliminate those and find out, where that takes you. But as far as supplements, ginkgo biloba, curcumin, omega-3 oils, resveratrol, and I think a new supplement which is like resveratrol, but it's much better absorbed and more powerful, is called pterostilbene. It's what's found in blueberries. And I think that it's going to be very beneficially effective on people because it's better absorbed than resveratrol. And resveratrol has been a wonderful supplement. And lastly, plenty of olive oil in your meal. I think that's important too. So that's what I would say. It covers pretty much what you want to cover.
What's a daily kind of regimen, maybe including food and or supplements for a person for good lymphatic flow?
Ketosis in your body. You should have maybe a fasting, a 12 to 16 hour fast, 2 meals a day, maybe one day every week or two that you 24-hour fast, omega-3s in your meals, olive oil, fats. You want ketosis because that creates growth factors, brain growth factors. And the meals consist primarily of vegetables, and although we try to avoid dairy products and etc., but we will have yogurt, goat yogurt or Greek yogurt, and berries, blueberries and strawberries. And those are very, very good. The berries are very good in what they call BDNF, which are the neurotrophic growth factors. So we try to do that. And my wife gives me more supplements than I know. I can't even start to tell you about them. The other supplement I mentioned that is very good is NAC. It's a very good anti-inflammatory, and it's been used in peer-reviewed journals for decreasing oxidative stress in cardiac studies. One I can think of from Cleveland Clinic. That very, very effective in preventing oxidative stress. So we take a lot of supplements. We try to get a ketosis. We won't have red meat for maybe once every 3 or 4 weeks. I'll have a steak. But a lot of fish, a lot of vegetables. A lot of the vegetables have wonderful properties. And so my wife is a vegetarian. She'll eat some fish too. So that we have maybe 12 to 16 hours that we don't have any food.
That sounds like a great, healthy, nutritious, and tasty lifestyle approach. Dr. Lemole, thank you so much for joining us on Vital Signs again.
Thank you for allowing me to be here. I appreciate it.
We've learned that good lymphatic flow can clear toxic factors that may otherwise lead to Alzheimer's disease. Qigong and meditation, exercises that make you sweat, and supplements like ginkgo biloba, curcumin, and omega-3 can all help enhance general lymphatic flow. Fallon, and I look forward to seeing you here on Vital Signs again soon.